Hi folks, welcome to episode 5 of the Chronic Back Pain Roadmap. In this episode, we're going to look a bit deeper at some of the unsuspected causes of back pain. So up until this point, we've focused on keeping things simple and straightforward. But in many cases, the simple and straightforward solutions aren't enough, and we need to look a bit deeper. Now, this was my personal experience with dealing with my own pain and what I found when helping others in chronic pain. So what we're going to talk about today, I believe, is the root cause of most persistent, niggling pain issues. That cause can simply be defined as a metabolic issue. It's basically an issue with your physiology and your ability to use energy properly. So as we touched on in the earlier episodes, the body has self-healing and self-organizing mechanisms. It generally knows what to do and it knows what it needs. But then, if that's the case, why haven't things gotten better? And that's the question we should be asking ourselves. In the simplest terms, the body hasn't gotten better because it doesn't have the means to get better. It doesn't have the raw materials and time to create a better outcome. You see, the brain, which governs all processes in the body, has to sort of prioritize certain things over others. Certain bodily functions are more important than others to ensure your survival. For example, your brain, heart, and lungs are critical to your survival on a moment-to-moment basis. But on the other hand, your foot, or one of your lumbar vertebrae, or your pinky finger, or even your reproductive organs aren't necessary for your immediate survival. You can survive for a long time without these. You cannot survive for much time without a brain, heart, or lungs. So there's a sort of hierarchy, and because of this, the available nutrition and energy has to be divided accordingly, because everything has a cost. And in order for you to be alive and for everything to keep working, it requires a certain amount of calories. It requires energy. And if there's a lack of energy or the body has become unable to efficiently and properly use energy, then issues will arise. The analogy I like to use is that suppose you earn €1,000 per month and it costs €500 to run your brain, 300 to run your heart, and 200 to run your lungs. At the end of this, you have nothing left over for the other parts of your body. So there needs to be enough money, so to speak, going in to look after the body's needs. However, what can also happen is that the body has lost the ability to use the resources efficiently. So again, for example, the money is going in, but it's being mismanaged and you're not getting the full value of it. So you're putting in €1,000 and you're getting €800 worth of value, hypothetically. And of course, this is a really simplistic way of illustrating this point, and it's not 100% physiologically accurate, but the point stands that everything has a cost and you need to provide sufficient energy for your body to function at its best. And also, your body needs to be functioning well enough that it can actually use that energy properly. So there's two sides to it. This gets us into a deeper rabbit hole of how do we actually heal the body at its most fundamental level. Because within this hierarchy, we have to recognize that no matter what we throw at your low back, the issue will not be fully resolved until your body takes care of its priorities. Because no matter how much your pain bothers you, resolving it is not necessary for your survival as long as there are other more important issues. And again, it's worth reminding ourselves that these things are instinctual and unconsciously driven. We can't really outsmart these survival mechanisms. So before we start discussing solutions to these issues, I want to help you determine whether or not this is relevant to you. So on the surface, this is going to seem unrelated to your pain. And to be honest, it may in fact be unrelated. But in my experience, it's often very relevant. We have to remind ourselves that all forms of stress influence pain. And if we remind ourselves of our biopsychosocial model, which we covered in episode 2, we'll remember that any stress on the body can increase the likelihood of feeling pain. So if you've found that the traditional and more obvious avenues of treatment haven't been working for you, then we need to consider the bigger picture. And this is the next logical part of that bigger picture. So how do we know if you may have an underlying physiological issue that's relevant to your pain? Some of the most common symptoms that indicate an issue are depression, anxiety, or any kind of mood disorder, trouble falling asleep or staying asleep, waking up feeling groggy and sluggish, even a lack of motivation in general can be a sign, difficulty losing weight, a tendency towards yo-yo dieting or extreme dieting, depriving yourself from food, or fasting or dealing with intense cravings, and frequently feeling hangry, which is hungry and angry at the same time. Then any kind of digestive issues such as bloating, heartburn, IBS, constipation, diarrhea, or even more severe issues like Crohn's disease. Also any skin issues such as eczema, psoriasis, dry skin, even severe acne, and then issues with energy and fatigue. So ups and downs, imbalanced energy, blood sugar, highs and lows, and then feeling wired but tired, which is quite common. And then any circulation issues, most commonly a tendency towards cold hands and feet. And the list is sort of endless, to be honest. And it's pretty much any kind of other health issue that you may have. And this may seem a bit convenient. It's sort of like those drug advertisements where they say, hey, do you have one of these hundreds of common issues that everyone deals with on a daily basis? Then you should ask your doctor about Prozac or whatever drug they're trying to tell you. So I want to be clear that it's not the same kind of idea. It's very much about getting back to our biopsychosocial perspective. Everything works together and all forms of stress are relevant. And all these symptoms and problems I just listed are indicators of some sort of stress in your body. And if we think back to our stress and health scales, we want to do everything we can to tip the scales towards health. Now, this doesn't mean we have to solve all of these issues to end our pain. It just means that we have to address enough of these issues that we allow the scales to tip towards health, and we provide the body the opportunity to self-regulate and heal. Now, let's talk about some strategies to resolve the issue. When things get to this level, it's almost impossible to give specific advice because issues like this are so individual. So a true solution is beyond the scope of this video series, but we can talk about some simple strategies that should work no matter what your circumstances. The first is breathing. We covered this in episode 3, and if you've gotten to this episode because you're still unsure about the cause of your pain, then I can confidently say that you need to make proper breathing a staple of your daily habits. You should set aside a couple of minutes several times per day to practice slow, deep abdominal breathing. For example, what you could do is 2 minutes after each meal, after any training sessions you're doing, and before bed, and then whenever you're feeling overwhelmed. If you do 2 minutes of breathing at these times, these will offer significant benefits to your health and to your pain. There isn't a single more effective strategy for improving your body's health that's so readily available to you at all times. So I can't overstate this enough. Commit yourself to a daily breathing practice if you want to create lasting improvements to your health and pain. And for specifics on breathing, refer to episode 3 again and have a look at the resources in the description. I've included tons of useful content to help you start breathing properly. The next simple strategy that you can use is to eat a raw carrot salad every day. This probably seems like a really odd strategy, but it works by reducing some of the most common sources of internal stress in your body. I've included links in the resources section if you want to understand the fine details of this, but in a nutshell, the carrot fiber acts as a sort of sponge in your digestive system and soaks up harmful substances. And these substances accumulate because of high levels of stress hormones in the body, and then in turn, they become an issue of their own that the body has to deal with. If we can minimize this, the body has a far better chance to self-regulate. This should go without saying, but obviously if you have some sort of allergy to carrots, then you shouldn't try this, but as far as I know, that's highly unlikely. So just use your own judgment and make an informed decision for yourself. So the recipe is very simple. I'm going to give you 3 versions of it based on how much time you have. Option 1 is to simply peel the outer skin off of the carrot and eat the raw carrot whole, making sure to chew it thoroughly. If you're stuck for time, do this version, but try your best to go for options 2 or 3 as much as possible. For option 2, you simply peel the outer skin off, get rid of that, then peel the carrot into long strips. These should be thin enough as shown in the picture here, and just eat these strips as a sort of salad. Now, option 3 is the same as option 2, except you're going to add some extra ingredients that are going to enhance the carrot's effects. So you're going to add a tablespoon of coconut oil, which you can melt if you prefer, a few drops of filtered cider vinegar, and a good few shakes of salt to taste, just whatever amount allows it to taste nice, and then mix it all up and eat it as a salad. It's best to have this in between meals, either around mid-afternoon or mid-morning, and to have it with something sweet, like a piece of fruit or a small bit of juice. Again, it seems like a really odd strategy, and maybe you can't see how on earth it would help. But if you're skeptical, good for you. You should be skeptical, but read the resources and try it out for a week or two and see how much better you feel. Decide for yourself and monitor how your body changes. Now, beyond these two strategies, I'm not comfortable making specific recommendations because when pain is caused or sustained by some sort of underlying physiological issue, as we've been discussing in this episode, it's extremely hard to give advice without assessing you individually. And it's not something you want to play around with without knowing exactly what you're doing and why. As I've gone deeper into the study of health and pain, I have found that issues like these are far more common than we might expect, and they are often under-recognized. I believe so many cases of chronic back pain persist because we don't recognize the relevance and intricacies of what your physiology is doing. And this is at the heart of what I'm trying to change in the way we approach back pain. Because if you're in pain, the first thing you're going to think of is, I'll go to my doctor for an x-ray, or I'll go to my physio or chiro for an adjustment. The focus is immediately on the structural side of the body. Yet we know, as I covered in episode 1, that structural issues are poor predictors of pain. So something is missing in the way we approach back pain. The physiology is a significant part of what we're missing. So in order to solve this part of the problem, I've evolved my work to look at things through this lens while still giving the traditional approaches their due place. So I offer online courses as well as private coaching to help you resolve issues like these, as well as tons of content via social media and my newsletter to help you make sense of things. So if you suspect that the root cause of your pain lies entirely or partly in an underlying physiological issue, you'll want to have a look at the resources I've included and take a look at my courses and private coaching options. Now, if you're really unsure and just want more clarity on this, you can also apply for a free online coaching session where we'll discuss your needs and your circumstances and lay out a clear path to recovery. You'll leave with clarity on what is causing your pain and peace of mind knowing that you're on the right path to becoming pain-free again. So that's it for this episode. Be sure to try out a daily breathing practice and a daily carrot salad and see what positive changes you can create in your body. Then have a look at the more in-depth resources and we can work together to get you out of pain once and for all. In episode 6, we'll delve deeper into the mind, its relationship to your pain, and some strategies to help you get better. So be sure to check that out. So thanks again for watching. Make sure to subscribe, like, and follow The Back Pain Coach on YouTube, Instagram, and Facebook, and sign up for the newsletter. Thanks again for watching, and I'll see you in the next video. Have a great day.